Welcome to chapter 1, week 8 of the foundation of the Canadian healthcare system. Da da da! I know a lot of you are thinking about going into the healthcare field, so this is some critical information. You should understand the field in which you are working, right? You need to know the broader picture of how things operate, which will help you in your job be more effective, right? Knowing how the entire system works. So that's what we're going to do. We're going to go through a brief overview of the healthcare system. This week, we're going to talk about the history of it. Like, how did we end up with the healthcare system that we have? In the present day, which continues to evolve, right? It's not like we live in a culture, a community, society in which the healthcare system is stagnant. It continues to improve and get better all the time. I will let you watch this video during your own time. And maybe I'll play it during the live session. Okay, daily agenda, very simple. History of healthcare in Canada. Before we jump into that, I'm going to talk to you about your textbook. So every week I will give you a number of lecture questions. Those questions have to be answered by the time we finish our session. If you have the answers to those questions and you understand that, you should be in good shape. That's what you're responsible for. Here's a pro tip. At the end of each chapter of this textbook is a summary. It is a 1 or 2 page bullet point list of what needs to be covered in that chapter. So I would start by reading this textbook. I would start with the summaries, go through them, highlight them, then go back and read the chapter, because that will let you know what is super important in that chapter. I don't think you'll get by with just reading the summaries. Like, I think there's just kind of a brief overview, but it is a good place to start because that will give you an excellent idea of what needs to be covered. I'd also encourage you to create a timeline in your notes so you're clear of what happened when. In a glossary, there's going to be a number of terms that are going to be familiar or not familiar to you. So by creating a glossary, that's going to really help when it comes time to study. Okay. If you do not know who this person is, you absolutely should. I'm going to play a video during the live session that goes over who this person is. If you don't know now, you definitely will by the end of this course. This is someone named Tommy Douglas, and he has been credited with the invention, the foundation of our healthcare system, for fighting for years and years and years to try to get a universal healthcare system here in Canada that doesn't exist in so many other countries. Here's a quick video that you can access about Tommy Douglas. You can Google his name. You can type it into YouTube. There's going to be a lot of information out there about him because, as I said, he has been credited with being the founder or the father of Medicare. Okay, so here are some questions we need to ask ourselves. The Canadian Healthcare Act was really designed for a number of things. It wanted healthcare to be universal, right? It needed to be anywhere in the country, regardless if you're a Canadian resident, that you have access to this healthcare system. So is it truly universal? Is it truly accessible to everyone? Is healthcare provided to all Canadians uniform? Is it the same no matter where you live or what your economic status is? And is healthcare delivered in a timely fashion to all people? These are some of the goals of our healthcare system. The question is, are we meeting these goals? Let's find out. Okay, I referred to this earlier in the lecture. Every week we'll have guiding questions. This week we have 10. Once we've answered these 10 questions, we have gone through the content, we have learned the material that we need to know for this chapter. The healthcare portion of this course is drastically different than the success portion. The success portion was largely about developing skills and habits to be successful in school. The healthcare portion is more about content. It's more about, here are the definitions, the structures, the models. This is how the healthcare system is organized. And you need to have a good understanding of how all of that operates. So it is much more about content and less about skills. Okay, what are the healthcare responsibilities of the federal and provincial government as outlined in the British North American Act? So we have two levels of government that are responsible for the healthcare system in Canada. One is the federal level and one is the provincial level. But who is responsible for what? Okay, so in 1867, the British North American Act was established. It included Ottawa, Quebec, New Brunswick, and Nova Scotia. And each province had its own representation, its own lawmaking body and lieutenant government. That's where things started. That was the very beginning of trying to be unified as a country. So here's the division of the healthcare responsibilities. So originally, in the British North American Act, very little attention was spent with healthcare. Like a number of other countries, the Canadian government just didn't see it as their responsibility to make sure that people had access to healthcare and were healthy. So now the federal government is responsible for the maintenance of marine hospitals, the care of Aboriginal populations, and the management of quarantines, like international quarantines. The provinces are responsible for managing hospitals, asylums, charities and charitable institutions, and all other healthcare related responsibilities. So the province carry the majority of the responsibility for healthcare in the province, and the only thing the federal government is responsible for are military hospitals, Aboriginal populations, and quarantines, because quarantines obviously impact the entire country, right? So if people needed to be quarantined, that is a federal responsibility. So divisions of responsibility continued. So in 1919, the Department of Health was created. So it wasn't until 1919 that we see even a Department of Health in our country. And it was in 1944 that it was renamed to the Department of National Health and Welfare. And the federal responsibilities expanded, right? They started to care a lot more about food and drug control. They started to care a lot more about the development of public health programs, health care for members of civil service, and the operation of laboratory of hygiene. So in 1944, we see the evolution of the federal government's responsibilities within the healthcare program. And then the department was renamed to the Healthcare Canada or Health Canada in the late 1990s. So not a long time. It's not been around for a long time, given how old the country is and how long people have lived here in Canada. Okay, so what organizations attended to healthcare needs of Canada in the 18th and 19th centuries? So if you were around in the 18th and 19th century, you couldn't go to the emergency room. You couldn't just drive in, throw them your health card and say, listen, I'm dying. I just got in a car accident. I got, maybe not a car accident, I guess, in the 18th century, but I got run over by a horse. I broke a leg. I have typhoid, whatever, measles. You can't just go into the hospital. You can't. There's no phone a doctor on the phone or do a Skype meeting or whatever we can do these days. So what did people do? Doctors first arrived with European settlers. Mostly they came from England and France. And the first medical school wasn't even established till 1825. And look at this. This is like many other countries, right? Only the wealthy could afford healthcare, and those who could not had to rely on religious and charitable organizations and maybe some help from family and friends. So you were responsible for maybe trying to go to a church or some volunteer organization that says, please take care of me. I'm dying here, right? The role of volunteers. So in the 18th and the early 19th century, these were the organizations that help people. The Order of St. John, which is St. John Ambulance, still around today. The Red Cross, also around today. The Victorian Order of Nurses and Children's Aid. Those were the organizations that stepped up and tried to help people who were sick. It was either that or you just relied on your family. So there wasn't a ton of help back then. Okay, if you were in an Aboriginal community, it looked way different. You often relied on a shaman, which was a medicine man, and these were healers. They were Aboriginal healers, and they didn't necessarily believe in Western type of medicine. They believed that your connection with Mother Earth was very important. They believed that they understood herbal medicine, that they use plants and roots and various different types of organic and natural solutions. Naturopaths, right? Like this is what we call a naturopath today. Someone who uses natural remedies and doesn't rely on the modern medical system. And many traditional medicines have been incorporated into contemporary Western medicines, which is really fascinating. So a lot of the stuff they were doing when Europeans arrived were working, and the Europeans eventually adopted a number of their medicines and their medical practices, which is really cool. Okay, how and when was healthcare insurance introduced? This is what they have in many other countries now. They have this healthcare insurance. So you pay into an insurance just like you do in your car or if you own a house. And if something goes wrong, you go to the insurer and you say, listen, I'm injured, I'm sick, I need treatment, I need to cash in on my insurance. So in 1919, a publicly funded healthcare system was formed as part of the Liberal election, but it was not successfully implemented. So they started in 1919 trying to get this rolling. And although they were successful, they couldn't get it implemented. And in 1935, the Conservative government pledged to address social issues such as minimum wage, unemployment, and public health care insurance. So in 1940, the provincial and federal governments amended the British North American Act and introduced national unemployment insurance. And in 1944, they had the baby bonuses. So you have to know that before 1940, if you were unemployed, sorry, it didn't matter. But by 1940, they developed a system that you paid into, and if you lost your job, you were able to get an unemployment insurance. I wonder what they would think about CERB now, back in the 1940s, the way things are now. Okay, so it really was post-World War II. This is what changed things. People came back after World War II and thought, listen, we've seen some horrific things. We really want a country that is secure and safe and equal for everyone. We don't want the rich getting the treatment, the poor not getting it. We want to have a publicly funded system. So this really didn't take root in our values until after World War II, which is really interesting because the US was also part of World War II, and the US has gone in an entirely different direction. But this is something that Canadians wanted. And so they started to invest in medical discoveries. There was advancements in treatments and cares and diagnostic capabilities. There was a shift to hospital-based care. People started to be able to go to hospitals. And then in 1948, the federal government set up a number of grants to fund the development of a healthcare system in partnership with the provinces, which is the current structure right now. A lot of the funding comes from the federal level and is funneled to the provinces to then operate the hospitals and the healthcare system as they see fit. And then in 1952, these grants were supplemented by a national old age security. So they also started to feel like if you're old and you couldn't afford to work, you should be taken care of. And then 1954, the federal government began providing support for adults who are also disabled and not able to work. Okay, so how and when was the concept of prepaid hospital care introduced? The idea that you can get it prepaid and then be reimbursed later, right? So in 1957, the federal government introduced the Hospital Insurance and Diagnostic Service Act, which provided federal money to the province and the territories that were willing to implement a comprehensive hospital insurance program. So the late 1950s, early 1960s is kind of when this began to roll. So again, not very long in the grand scheme of things. Some of you might have grandparents who knew when there was not universal health care in Canada. Some provinces and territories were not able to implement the program because their population was too spread out. And through an equalization payment system, richer provinces could share some revenue with poorer provinces in an effort to help all people, regardless of where they were born and where they were living, have access to health care. The Hospital Insurance and Diagnostic Act provided residents with full care in acute hospitals and included care for outpatients as well. Here he is, Tommy Douglas, known as the father of Medicare, was the premier of Saskatchewan from 1944 to 1961, and he campaigned his whole career for comprehensive hospital and medical insurance. And then the Saskatchewan Medical Care Insurance was passed finally in 1961. This is the man you have to thank for your health care. This is where it all started in Saskatchewan in 1961. And then after that, most of the other provinces and territories adopted similar plans to what was happening in Saskatchewan. Number 5. We're getting there, halfway there. List and describe 3 pieces of legislation that played a significant role in leading up to the creation of the Canadian Health Act. Here they are, the significant events. The federal government remained committed to the Comprehensive Health Act and significant events leading up to it. These are 3 of the acts: the Hall Report, the Medical Care Act, and the Established Programs of Financing, or the EPF. I'm not going to go into an incredible amount of detail about these reports because you just don't need to know it, right? Maybe you know a little bit about the names, what happened, but you don't need to know all, you don't need to memorize all of this. So here's the Hall Report in 1960, the Medical Care Act in 1966, and look at, this is where the idea of universality, portability, comprehensive coverage, and public administration came from, which are pillars still today. And then the EPF. And this had to do with a lot of how was it all funded? How did the money flow through the federal government to the provinces? 1977, right? That really is not that long ago. Okay, list and describe list and describe the criteria and conditions for the Health Care Act. So the Health Care Act became law in 1984. 1984. And the Act received royal assent in 1985. The Act governs and guides and perhaps limits the healthcare system that we have today. And the Act's primary goal is to provide equal, prepaid, accessible healthcare to all eligible Canadians. Those are the ones that are residents of a province or a territory. This is the thing you may not know. If you are not a resident, you do not have access. So even though you are a Canadian, If you are Canadian, you will move to the States, or you live in Jamaica or Ethiopia or wherever. If you are not a resident here, you don't have a physical address, you don't have access to healthcare. Okay, here's the criteria. Public administration, so it cannot be private. Comprehensive coverage, has to cover everything. Universal, portable, accessible. Conditions, they must provide information. So the provincial government must provide information to the federal government about how things are going, where the money is being spent, and what their needs are. And then they need to recognize, they need to formally recognize the federal government for the contributions they make to our provincial healthcare. Okay, what is meant by these terms? Medically necessary, extra billing, and user chargers. And how do those relate to each other in the context of the Healthcare Act? Okay, so the Healthcare Act does not deny or detail which of the services should or should not be offered. So this is where it gets a little bit gray. The federal government doesn't say you need to run these certain programs. They just say you need to provide comprehensive care. So you could have different provinces offering different medical coverage depending on what they deem as necessary and comprehensive. So this is where it gets to be a little bit gray. So the federal government will deduct an amount of extra billing or user fees collected to the provinces or territories from transfer funds. So basically what happens is the money goes from the federal government to the provincial government, and the provincial government uses that money to cover all the services that are medically necessary. So here are some examples. Extended health care services considered medically necessary include intermediate nursing home care, adult residential care, home services care, services provided by obligatory care centers. So medical necessary is a very important term, because if it is deemed medically necessary, you get coverage. If it is not deemed medically necessary, you do not get coverage. I'll give you an example. Circumcision. Circumcision is no longer required or considered medically necessary here in Ontario. Therefore, if you have a son and you want your son to be circumcised, that is something you have to pay out of pocket for, where that may not be the case in other provinces. So this is why that terminology is so important. So what are the goals of the primary healthcare reform? Here they are. I took a screenshot and put them in here for you. It is in table 1.1 of your textbook. I'm not going to go through all of these goals here at this point, but you can do that on your own time. But here are the goals of the primary care reform. Healthcare responsibilities. Okay, so Health Canada works with provinces, we've talked about this, by managing the funds, ensuring the compliance with the Healthcare Act. So it provides healthcare coverage. We've talked about this. Federal government provides healthcare coverage for the military, the Royal Mounted Police, the First Nations, military veterans, inmates, and potentially, I've seen this. I was in a hospital once and I saw someone come in shackled, handcuffed and shackled, because the provinces are not responsible for the healthcare of inmates. It's a federal, if you're in federal prison, it is a federal responsibility. And then sometimes residents of remote or isolated areas also falls under the responsibility of the federal government. Okay, after the Canadian Healthcare Act commissioned reports and accords, again, I'm not going to go into a ton of detail here, but what you need to know is that in 1986, the Ontario physicians participated in a 25-day strike in opposition of this act. The federal government took steps to remove extra billing and user fees, but these practices were not entirely eliminated, right? Because they like that. Like, physicians like the fact that they could charge extra fees and user fees and do all this kind of stuff. And the federal government was trying to make everything uniform. Hospitals struggled to function in budgets, right? And they still do, leading to some shortfalls. Alternative healthcare strategies emerged. The primary healthcare reform began because it's very expensive running healthcare systems. So they weren't happy that they were denied this, I don't know if you want to say right, or maybe they were denied the ability to charge these extra fees, these extra billing. So obviously they weren't happy and they took 25 days off. Imagine that. Imagine the doctor shut down for 25 days. What would happen? Okay, so first ministers gathered in 1997 to form a social renewal program and press Ottawa for funding increases. So all provinces and territories, except for Quebec, of course, always doing their own thing, took to Ottawa to try to get them to increase the funding. And the social union agreed to maintain the 5 criteria of the Healthcare Act. And the federal government promised, I promise, to give you more money to be spent in the hospitals. Okay, list and describe 3 major reports on the status of the healthcare in Canada. Here are the 3 reports: the Makowaksky report, the Kirby report, and the Romanowo report. Sorry, I know I butchered those, but these are the 3 reports here. I'm not going to go into a ton of detail because you just don't need to know that. You don't need to know it. It's there if you want to do extra reading or if you want to dive in your textbook. Go crazy. Okay, question 10. We have arrived. We have made it to question 10. Summarize the 2017 Healthcare Accord and the initiatives that followed. So the federal government offered a 3.5 increase in the Canadian healthcare transfer. Provinces and territories countered with a 5.2. See, it's a little bit of a negotiation back and forth. All provinces negotiated individually and in a case-by-case basis. And that's it. That's what happened. They got a bit more money, but maybe not as much money as they wanted. Okay, that was a brief overview of the history of healthcare in Canada. I know that some of those pieces might be a bit dry and maybe there's a bit more detail than we need to know, but you are welcome to open your handy dandy textbook and read in more detail. Like I said at the beginning, the important thing is to look at the summaries. Look at those summaries in the back of your textbooks. They're 1 page. Pull out the chapter questions, create a timeline and a glossary. And if you can answer the 10 questions, where are they? The 10 questions that are somewhere here. If you can answer these 10 questions, then you are in good shape. Okay, like always, I'm hoping that was useful. If you have any questions about any of this information, please do not hesitate to reach out and ask. And have yourself a great rest of the day.